Hello everyone. It's exciting to be here. I really want this video, you know, to capture, when I commence treatment. I know because of the story, we're talking a lot about how it all started and how I got the lump out and the biopsy and all that. Right now, I would want to start from the visit to the hospital. I know that visiting the hospital, they definitely that's where treatment should start. This took place like July 2022, where I started visiting the hospital, and visiting the hospital, I had to run series of tests. You know, the doctor sent me for series of tests, and and she put it, you need to be fast about this. So I was really anxious. I was like, okay, let this start and let us start doing what we're supposed to do. And I went for this test. They're quite a number, and also they're not cheap at all. So I had to do everything to make sure that I ran all the tests, and I did the I did the mammogram. I did the CT scan. It covered the abdomen, pelvic, and chest. I also did the ultrasound breast scan, and then in the course of time also I did the echo scan, echo test, and also the ECG, and a series of many blood tests were carried out as well. And on when all these were completed, I had to go back to the hospital to see the doctor. You know, and basically on seeing all the results of his test, the doctor was able to diagnose, and the diagnosis was that I was down with um, invasive ductal carcinoma. Basically, it's affected my right breast, and it's there's an HER2 negative cancer. And what does that mean? That the cancer that I have, is hormone influenced. So it grows on the hormone, you know, and so they had to prescribe, medication that would help in that case. And, that's how I started my treatment. And basically, just to take note of this, cancer has so many subtypes. Breast cancer has so many subtypes. You don't just say I have breast cancer and then one treatment fits everything, and that's not true. So that was why I had to go through a series of tests, and for the doctors to come out and to know exactly, what treatment to give for the particular type of cancer I have. And this one I told you was the hormone, an hormone based cancer, breast cancer. And I had to be put on treatment in that line. Yeah, yeah, I said there are many types, and so one treatment does not fit all. So you cannot say, oh, because you have breast cancer, oh yeah, use this and use that. That's why many tests are carried out, to streamline and bring out the best treatment plan for the individual. After saying that, the plan that was brought out, not necessarily the treatment plan, because we're still working on the treatment plan. But since I identified that it's an hormone-based cancer, so I was placed on an hormone therapy. And this particular treatment is a tablet of anastrozole, 1 milligram. The anastrozole basically works on the hormone, and that's why I was given that particular medication should be taken one a day for the next 5 to 10 years. So I started that July 2022, and basically that particular medication has a long list of side effects, and I just thank God that even as I started taking it, I was good with it. It did not disturb me at all, because I know the doctors asked how far, and nothing. So I was good with it. I just felt well, that was it. But basically, I read through all those side effects. And a doctor friend of mine just advised me that I should go on, vitamin D3, because of the bone, that it talks about depleting. And anyway, that's after I did that, I started taking it. You won't believe it. I took it for a while, and there was a time I started feeling pain in my bone on my left arm. The pain will move from particular place to another, and all that. It was really, really excruciating. It wasn't just a pain, ordinary pain. It was a serious, serious, intense pain. And many a times, I couldn't sleep on that arm, or if I carry it up, it aches, and so it just aches in ways that were very, very uncomfortable. And sometimes it just aches, and I start feeling up to my brain, and I have to drop everything I'm doing, just to go and give myself, just stay in a place and just calm down, for my brain to calm down, the pain to calm down, and then before I can do anything. This can take hours, you know. So I continued like that, and I didn't find it funny, because I kept on either using the bandage or using the balm, just to ease the pain, and I went on like that. At a point in time, when I went for one of my appointments, I mentioned that to the doctor, and here the doctor, he didn't really have anything to say about that. But one of the doctors, in the team, just mentioned that, is that medication? No. And I said, that medication, which medication is this you're talking about? I said, the hormone therapy. I said, really? The hormone therapy that I'm to take for 5 to 10 years is stopping me this way. Can I cope with it? So I asked the doctor. Well, doctor typed a pain reliever for me, and well, I went and I started using that. Definitely was easing it, but I wasn't, I wasn't, ready to live on pain relievers. So it was still very disturbing. And to a point where I had to just call the doctor one day. I just had to say, doctor, please, I can't cope anymore. Please, can I come and see you? And so I fixed an appointment, and I went to see the doctor. And then I was seeing the doctor was like, how am I going to do it? Okay, maybe you have to run a bone scan, so that we can be sure that there's nothing, connected to these pains. So I said, okay, I'll run a bone scan. And basically, a bone scan is not a scan that you just go into any diagnostic center and just say, I want to run a bone scan. It's not done that way. And even I hear that, even in Nigeria here, you just have 3 centers of that carry out that scan. And so it's something that you have to book ahead, and giving you what appointment you can get and all that. So anyway, that went on, and within a month and a half, I got that appointment to go on the bone scan. And I ran the bone scan, and I got the result, and thank God. Ah, my fears. I had these fears, though. The fears, I was like, please go. I don't want any other cancer in my body. I was my prayers. Let nothing bone. It was scary. But thank God, it came out clean. The doctor was happy. There's nothing there, just pain, continue the pain and all that. So that's what I did. I continued. So the pain actually started easing out bit by bit. But we're moving from one place to another. Presently it's on my wrist, my left arm, my wrist. It's still on that, it's on the wrist. But it has gone down drastically. It has gone down just as I speak to you now. And it's something that, as a result of that hormone therapy that I started, and that was how I commenced my treatment. And my next video, I'll definitely talk about more on on the further treatments I had to go through. Thank you very much for listening. Thank you.